Our group studied Marfan syndrome, which is a genetic connective tissue disorder that was first discovered in France around 1896. It was named after the man who first began studying it, a professor of pediatrics named Antoine Bernard Marfan. It is one of the most common connective tissue disorders, with estimates of affected people being about 1 per every 10,000 to 20,000 people. This, however, is not entirely accurate because it also is estimated that Marfan syndrome tends to be underdiagnosed. Marfan syndrome mainly affects the skeletal system, but it has many varying effects on many different people. But some of its most notable traits are a tall stature, issues with the aorta, and issues with the eyes.
Marfan syndrome, also known as MFS, is a heritable condition that varies from person to person but has an overall impact on the whole body, specifically the connective tissue that is used for healthy bones, organs, and muscles. Having MFS being an inherited condition, that means it is passed down from a parent, or in some cases, it can just be a new mutation in the gene of a baby. Marfan syndrome is caused by a defect in the gene that tells the body how to make FBN1, also known as fibrillin-1. FBN1 is an extracellular glycoprotein that serves as a structural component. With this mutation, the microfibrils do not properly form, leading to the weakening of the connective tissue that is then supporting those organs throughout the body. With the lack of FBN1, this then leads to the result of an increase of TGFB, which stands for Transforming Growth Factor Beta. This is the protein that is then responsible for the overproduction that can have an effect on the heart, blood vessels, bones, tendons, eyes, nervous system, and so on.
According to National Human Genome Research Institute, Marfan syndrome is the most common inherited disorder that affects the connective tissue. Since the general structure of Marfan syndrome attacks the body's connective tissue, it causes a general mutation in a protein called the fibrillin, also known as FBN1 gene. The gene that affects the body forms elastic tissue within the connective tissue. Marfan syndrome is caused by a defect in the gene that encodes the structure of fibrillin and elastic fibers, a major component of connective tissue. The pattern is called autosomal dominant, meaning it occurs equally in men and women and can be inherited from just one of the parents with Marfan syndrome. People who have Marfan syndrome have a 50% chance of passing along the disorder to each of their children. According to Cleveland Clinic, 25% of cases, a new genetic defect occurs due to an unknown cause. Marfan syndrome is also referred to as a variable expression genetic disorder, because not everyone with Marfan syndrome has the symptoms to the same degree. The gene mostly affects the eye, skeleton, connective tissue, and cardiovascular systems. Compared to a normal functioning body, the syndrome causes finger, legs, and arms to be longer. Men and women have a short torso and abnormal chest, lungs, and heart problems. They are tall and thin and often affected by scoliosis. When you see someone affected by the disease, you can see bones protruding from their body and stretch marks that cover the stomach. In extreme cases, the FBN1 gene has no body or fat tissue. Not only does it affect the fat and tissue, but also narrows the face that affects the roof of the mouth, making it arch. To diagnose Marfan syndrome, a blood test can be used. The blood test is highly specialized and looks for changes in the FBN1 gene.
Homeostasis means steady or same. It refers to any process living things use to actively maintain stable conditions. Marfan syndrome disrupts homeostasis by making one of the two copies of the FBN1 gene not work and produce less fibrillin-1. Marfan syndrome disrupts the body's ability to keep connective tissue strong versus someone who doesn't have Marfan syndrome body's ability to make and maintain strong connective tissue.
Now that you're informed of the disease and its complications, it is important to be aware of the everyday life of a person with Marfan's. The everyday life has now been made more satisfying due to medical advancement. With Marfan syndrome being a very serious condition, accurate and early diagnosis is necessary to save the lives of people. Visibly, things that may stand out are as follows: crooked teeth, sunken eyes, tall and very skinny. Not much muscle, if any, is visible, and some may have posture abnormalities if spine or pelvic formation is compromised. Each day, medications and sometimes procedures are needed to keep these individuals alive with minimal pain. Along with medications, there are recurring appointments made to ensure that the Marfan features do not get worse. Some of the so-called features will include not as significant things such as crooked teeth, but keep in mind internal abnormalities are what is more significant in terms of safety for these patients. People with Marfan syndrome are very likely to have a collapsed lung, retinal detachment, which will cause the loss of vision and even aorta enlargement. If any features do get worse, often surgeons will operate to fix or prevent an issue from continuing. These surgeries can be scheduled but are sometimes right away depending on severity. These surgeries are often going to result in lots of pain for the patients, and they also struggle with aches and pains each and every day. The Marfan syndrome affects many different systems, so not all cases are going to look the same. Due to the phenotypic variability that comes with this disease, each patient is treated differently and will have different limitations in life. One limitation that will mostly be needed in all cases is limitation on physical activity. This is because Marfan syndrome affects connective tissues throughout the whole body, and when these tissues are compromised, it can make for an unsturdy body and very weak joints. Individuals with Marfan syndrome are suggested by doctors to do low-intensity cardio and low-impact movement to ensure they do not add to the body's stress. This will help keep their heart in a healthy state while not overdoing the muscles to the point of harming the individual. Mainly, any contact sports or high heart rate activities are off the table for these people. Activities such as yoga or body weight movements are what best suits the health of these individuals.
It can be hard to pinpoint an exact demographic for Marfan syndrome because it does not affect one gender or race more than another. However, as we've talked about, it does have a strong hereditary component. As we mentioned before, if a person has this syndrome, they have about a 1 in 2 or 50% chance of passing the condition onto their child. However, there are about 25% of cases where the gene mutates for unknown reasons. The main way to predict if a person is likely to get the disease is whether or not they have a family member who has the disease. However, as I just talked about, that's not a surefire way to tell. Marfan syndrome affects many parts of the body and has some effects that go beyond just the mutation. For example, if a person has scoliosis due to Marfan syndrome, depending on where that curvature is in their spine and how severe it is, it could restrict their lungs or other organs. Marfan syndrome also affects the eyes because the connective tissue in the eye is not as strong as it should be. This leads to impaired vision, and the development of cataracts can be accelerated in these people. Marfan syndrome also has a large effect on the cardiovascular system, mainly on the aorta of the heart. It weakens the aorta and can make this disease fatal for some people. This is why this is the most important part of this disease to regulate, often using blood pressure medication to lower the blood pressure of patients and make sure that their heart doesn't have too much strain put on it. In addition to that, some Marfan syndrome patients also have to have heart surgeries because their heart is too weak to keep their body going.